Welcome to Wonder Hair Career Institute. My name is Livina. I will be your instructor for today's tutorial. Today we are going to talk about making an occupied bed. Making an occupied bed is changing soil linen when the patient is in bed. Occupied bed is done when the patient is too weak to get out of bed. The best time to change the bed is just after the person get a shower, although you should periodically check for crumbs, creases, or moisture, as this can make the bed uncomfortable and contributes to skin breakdown. Again, we're going to look at the skill checklist. So we're going to start from number 3 to 14. Number 3 says, keep resident position a safe distance from the edge of the bed at all times. You don't want to let that patient fall from bed while you are making that bed. Remember, the reason why you are making the bed while the patient is there is because he's weak. So you want to make sure you maintain safety at all times. Remove and replace bottom sheets on one side of the bed before turning residents to move and replace sheet on the other side of the bed. Of course, to remove the bottom sheet, you have to start from one side. Keep resident position on a bottom sheet throughout procedure. Meaning, when you remove the old bottom sheet, you remember you tuck in, then you roll the patient on the other side. So this person is not lying only on the mattress. At any point, he's lying on something, the bottom sheet. It's either the one you are about to remove or the new one. Secure bottom sheets to mattress. Of course, you're going to be using fitted sheets, so you want to make sure you get it right. Leave bottom sheets free of creases or folds. This is critical. You want to make sure that this bottom sheet is free of wrinkles. You know what wrinkles can cause on your patient. Remember, these people are weak. Remember, these people's skin is just fragile. You want to make sure there is no wrinkles on those sheets, because this could cause skin breakdown. Turn or position residents to remove or replace sheets without pulling sheets in a manner that creates friction and risk skin sharing. Again, you want to make sure you avoid pulling that resident that could cause friction or sharing, which can cause skin breakdown. Tuck top sheet under foot of mattress, leaving sheet placed loosely, avoiding pressure against toes and allowing for foot movement. Leave top sheet placed on top of resident to cover body up to shoulder without tucking in along sides. So you don't tuck the sheets on the side. Keep pillow position under resident's head throughout and at the end of the procedure, except when removed briefly to replace pillowcase. So at all times, there should be pillow under your patient's head. Complete procedure with resident position between the top and the bottom sheets. Complete skill placing soil linen in hamper and disposing of trash. Okay, now you have finished your occupied bed. Good job. Now I want to ask you a question. As a nurse aide, you are making an occupied bed. Which action do you think is very, very important? One of them is ensuring that the patient head is supported and is in functional alignment. Remember what we read on the checklist. It says, make sure that the pillow, your patient's head is on the pillow at all times, except when you are changing the pillowcase, just briefly. So it is very, very important that you ensure that that patient head is supported and is what? Functional alignment. And nurse aide must make an occupied bed. Which nursing action are essential? Right. When you're talking about essential things, you want to think about, safety of your patient. You want to make sure that the bottom sheet is free of what? Wrinkles. And what does this cause? Skin breakdown. You want to make sure there is what? A toe plate at the foot of the bed. Toe plate. When you finish your bed at the foot of the bed, you want to give your patient room to wiggle your toes so that she can move his or her toes, right? This is very, very essential. Why do we do toe plates? The toe plate allows the person to move his or her feet to relieve pressure on the feet. Again, that is essential. Now, if you didn't do the toe plate, now the sheet is tucked in tightly. What does that mean? You are restraining that patient. You are restraining that patient. Remember what restraint is. It's no in a facility. So you might think, I didn't tie this person down, I didn't do anything, but you made that bed and tucked in that sheet tightly enough that this person cannot move his or her toes. That is considered what? Restraint. Now, when you have in your pillow, you want to change your pillowcase, where do you fix the open side? Towards the door or away from the door? Yes, it is facing away from the door. Why? That is what avoid contamination. Remember, the door is where everybody is coming in. If there is flies coming in, it's coming through that door. If there's any infection flying around, it's coming through that door. So when you face that pillow facing the door, meaning that anything flying or that infection, which we cannot even see, could get into that pillow. That is just a simple rationale. Now, clean bed linen in a cleansed room, but no use, should be kept where? You have your patient in a room. Let's say your patient get discharged and you have a bunch of clean linens in that room. What will you do with those linen? Do you want to use it for another patient or keep it for the next patient that is coming in that room? Well, the answer is what? Put that in a dirty container. Remember the patient's room. Anything in patient room is considered contaminated, so you can use it for another patient. So when you are going inside the room to make your patient bed, to do anything linen, make sure you carry ones that you need. The sheet should be placed so that when you unfold it, the white hem will be at the bed and the hem stitching will be facing upward away from the patient. Remember, when you're making that bed, you have the top sheet on top of that patient. The hem stitching, do you want to be touching the patient? No. That area is kind of, I would say maybe a little rough than any of that place. So you don't want it to be on your patient, which could cause some irritation. All right? So when you're doing your bed making skills, pay little attention to all this, because this counts. If you don't get it, all these points, you might be losing a lot of points. Now, I think this little tip will help. Thank you for watching. I hope you enjoyed the lecture. If you do, please subscribe and hit the notification button. Good luck on your exams. Thank you.